Dr. Teresa Lyons, creator of Navigating Autism and Eat to Heal Autism. And this week's Ask Dr. Lyons question is: does your child with autism need inositol? Indications of need. All right off the bat, let's see what inositol is used for. Typically in the general population, it's used for anxiety, depression, panic disorder, obsessive compulsive disorder, as well as when you can't fall asleep. So if you're dealing with any of these, you'll want to continue listening to the rest of the video. What is inositol? Inositol was once considered to be vitamin B8, but it's not classified as a vitamin anymore. It's found in citrus fruits and other vegetables. Inositol is involved in many aspects of function in our body. The brain is highly sensitive to inositol depletion. So what the brain does is, with the blood-brain barrier, it limits the availability of plasma inositol. Therefore, the brain is very dependent upon recycling and synthesis of inositol. So the brain likes to keep a certain level of inositol and works very hard to maintain that. So inositol actually exerts an effect on serotonin levels. Inositol is a precursor of the second messenger for some serotonin receptors. And if you're familiar with serotonin, then you're familiar with SSRIs. So SSRIs, they're a class of drugs. Mainly when people talk about SSRIs, they're talking about drugs. But SSRIs block the reabsorption of serotonin in the brain, making more serotonin available. SSRIs are called selective because they seem to primarily affect serotonin and not other neurotransmitters. SSRIs also may be used to treat conditions other than depression, such as anxiety. And as I mentioned before, inositol exerts an effect on serotonin levels. Inositol and autism. That's why we're all here. So what kind of research has been done in those with autism with inositol? So there's one clinical trial, and it was published in 1997, and they looked at a controlled double-blind crossover trial of inositol with 9 children with autism. Now they used a very low dose, it's 200 milligrams per kilogram, and in that study it showed that there was no benefit whatsoever to children with autism. They did comment that higher dosing should be examined. And this is the only research, the only clinical trial that has been done in those with autism involving inositol. And as I mentioned, serotonin levels, which inositol can exert an effect on, serotonin levels have been explored quite extensively in those with autism. So there are anxiety drugs that are called the SSRIs, selective serotonin reuptake inhibitors, and many of you might be familiar with them. And they're a class of drugs commonly prescribed for those with autism. Drugs like Prozac and ephedrine. However, many physicians have noted that anti-anxiety medications seem to be less effective overall in people with autism than those without autism. So with this video, I just want to present you with the options. There are definitely supplements that are used in those with autism to address anxiety, obsessive compulsive, and depression, and there are also drugs. The interesting thing is the mechanism of action for those supplements and the drugs are very similar. So it's up to you and your physician to decide what's best for your child. And here are some references.